Welcome. Thank you for joining us at this noon hour for a really important discussion and an opportunity to learn from each other. My name is Liliana Lengua. I'm the director of the Center for Child and Family Wellbeing, and this panel discussion is one of the ways we share resources with the community to support child, youth, young adult, and parents' family well-being. So we're really grateful for you joining us. We're really excited to have this conversation with experts on the health, education, and mental health of children and families who are immigrant and refugee communities. And we hope that we're able to share some resources with you as well. When we planned this panel many months ago, we knew that it was an important discussion to have, and the topic and the time has made it even more critical than we could have imagined back when we planned it. So we're grateful to have this opportunity. Just a couple logistic points. We will be going through some planned questions with the panel. Your questions we will have time for towards the end. And we ask that you type your questions in the Q&A box. That's the one we'll be monitoring for your questions. If you have any technical issues or are having challenges that are coming up with the webinar, you can use the chat, and our team is monitoring the chat for that purpose. Also, we are recording this session, so you will receive a link to the recording when you receive an email a couple days after the event. Along with that, there will also be an evaluation survey, and we really welcome your feedback to help us think about future events and ways that we can offer things that are important resources for the community. The recording will also be available on our CCFW Resource Library website. Before we get started, I want us to think about and acknowledge our land and labor that has given us the opportunity to be here today. We ask everyone who's engaging in this event to reflect with gratitude and respect on the lands which we work and reside, and acknowledge all of the ancestral homelands and traditional territories of Indigenous peoples who have lived here for many, many generations. The University of Washington acknowledges the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. We offer our gratitude and respect to their elders and honor their past, present, and future connections to this land. We acknowledge that much of what we know of the United States today, including its culture, economic growth, and development, has been made possible by the labor of enslaved Africans and their descendants. We also recognize the immigrant and American-born workers of African, Asian, Central, and South American descent, whose labor contributes to the fabric, success, and well-being of our community. We recognize that the painful histories of white supremacy persist in present-day realities and privileges at the university and in our communities. We invite all to commit to dismantling racism and oppression by creating change where we live and work. Thank you for taking that moment with me. We're so grateful for the expertise in the room right now, and I'm just going to briefly introduce our panelists and then let them tell you more about themselves and their work and what they're doing. So joining us today is Beth Farmer, who's a clinical associate professor of global health, the director of the Northwest Health and Human Rights Survivors of Torture Program, director of International Counseling and Community Services, project director of the Pathways to Wellness, integrating refugee health and well-being. I hope I didn't miss any of your important titles. You're doing so much fabulous work. Also joining us is Anisa Ibrahim, clinical associate professor and a pediatric primary care provider at Harborview Medical Center's Pediatrics Clinic. We have Diem Nguyen, University of Washington professor in the Department of Global Health, who has a focus on global mental health. And Kevin Roxas, Dean of the Woodridge College of Education at Western Washington University. So thank you all for being here and welcome. I'm going to ask that each of you introduce yourselves a little bit more with a little bit more depth and tell us about who you are, the work that you're doing, who you're working with, and in terms of immigrant, refugee, and displaced communities. And share a little bit about your thoughts about how you're seeing this moment in time in terms of our political and funding context. So, what impact are you seeing with regard to health and mental health and well-being of the communities you work with? And let's start with Anisa.
Hi, good morning, everyone. I'm recovering my voice, but I'm Anisa Ibrahim. I am a general pediatrician and the medical director of the Harborview Pediatrics Clinic, where I have worked for the past decade. I think much of my work intersects with families and children of families who have a history of migration in one way or another. And I similarly actually share that same history. I came here to the United States as a refugee, as a child myself, and really experienced what it means to have a migration history. I fortunately came into this country at a time where migration was not perceived in the way that it is perceived right now, which is, I think, is an injustice to just human rights in general. Um, as a pediatrician, I see children every day and I see children's families every day, and I've seen them through the context of caring for a holistic child and a holistic family. And I think in this moment right now, both um, politically, but just as human beings, it's incredibly difficult because what I see the most often currently is a lack of safety and security, which is one of the most detrimental things for a growing child and a family who's trying to take care of themselves, their elders, and their children. I have been involved in refugee and immigrant work through many different sectors. Through the community, I was involved with community health boards for a long time and was a leader of the Somali Health Board. I was on the American Academy of Pediatrics Council on Immigrant Child and Family Health, thinking more nationally about the health of immigrant children, as well as the Society of Refugee Healthcare Providers, trying to think about how do we care for people with a history of migration. And I think what is always at the forefront of my mind right now is that when there's daily attacks, it actually takes um, away from a person feeling comfortable just living and existing. And I think I know that this is also happening to people who have been through tremendous amounts of difficulty in their lives, and they've seen how difficult things can get when regimes are unchallenged, and they've seen regimes that in some ways are far worse than what's happening right now. And that triggers things in people, that triggers fears in families. And we have parents who are trying to hide that from their children and give their children a life that they deserve. But as we know that, stress permeates through a family. So personally, the things that I've been seeing in clinic where I care for um, children who are unaccompanied, children who are, refugee minors who are also unaccompanied in this city, asylum seekers, children who are undocumented, and children who are either refugee or hold another visa status. And something that is seen in all of these communities is that one, there is a negative political climate for no other reason other than the fact that they came to this country, which everyone essentially, other than the people who are native to this land, has at one point or another. It creates first this mental health stress and this lack of safety, which then leads to mental health issues in children, which then can also lead to physical health issues in children and their parents. And that level of stress can change how communities are epigenetically. Without getting too into the weeds of things, it is a very, very important time right now because what we are seeing can never be normalized. And I think one of the things that is the hardest is that we are getting so much of this, right? And every day there is something else in the news, and our communities who are, last week it was my community, the Somali community was being attacked very, straightforward, and children were seeing that, and children were wondering, what did we do, right? That can never be normalized, and we must always, no matter how exhausting it may seem, take a stance and call out the injustice and let communities know that we will stand with them. And it is not alarmist for some families to think this is the beginning of something very, very bad, because it very well can be, and we don't know that. So injustice must always be called out every time.
Thank you, Anisa. Beth, why don't you introduce yourself?
Thanks so much. My name is Beth Farmer. I'm currently the Senior Director for the Safety, Health, and Education Technical Unit at International Rescue Committee. International Rescue Committee is a large humanitarian organization that was founded in the 1930s at the behest of Albert Einstein, in fact, to help get people, primarily people of the Jewish faith, out of Europe, scientists, artists, great thinkers, and others. And since that time, we've been doing forced displacement work around the world. And we are currently in 40 countries and 28 US cities. There's two big divisions within IRC, and I promise this all connects. There's the Crisis Response Division, Gaza, Afghanistan, Ukraine. And then there's the division that I'm in, which is resettlement, asylum, and integration. And that is places that people flee to find safety. And so I support the mental health programming, the unaccompanied children and child protection programming, and the trafficking programming or anti-trafficking programming, primarily in the US and in Europe. What are we seeing right now? I've been doing this work for many decades, and I will say this is the worst I have ever really seen it. I wish I could find something hopeful in the moment, and I do believe there will be an after this moment, but I will say it's very difficult right now. The safety system for people who have been forced to flee is really being winnowed away, so that it's hard for them to find safety in any country right now, including the US. At the same time, there is mass forced displacement. It's the largest that it's ever been. But also all of the other systems that help support safety and stability for people is also being attacked and dismantled. With HR1, you have Medicaid pretty much being decimated. People may not know that refugees and other covered populations that were previously able to receive SNAP food benefits were abruptly cut off. They were the first population that was immediately cut off from those benefits. And even places that people would go to seek safety, let's say they had been attacked, they had been a victim of a hate crime, they had been trafficked or exploited like the police, there is no real sense of safety that they can get protection from those services anymore. And the places that serve them, like our agency, and also like Dr. Ibrahim's agency, a hospital, we're all facing tremendous cuts so that services are even more scarce at a time that people need them more. The populations that we work with are refugees, asylum seekers, special immigrant visa holders, which most recently have been from Afghanistan and Iraq, people who have come in without documentation to the United States, trafficking victims, and U visa holders, which are victims of domestic violence that have received a form of protection in the US, as well as humanitarian parolees. Since the beginning of the year, in unaccompanied children, I should say too, since the beginning of the year, we have seen mass detainment and deportation, not only of clients that we serve, but also of staff. Unfortunately, we have seen people that followed every proper channel that the US government asked them to do to come into the United States. We've seen their statuses be stripped away from them, and all of a sudden they no longer have employment authorization, so they're facing eviction. Or they've lost their access to federal or state benefits. We have started a children's crisis assistance program with private funding because we're finding so many children have caregivers whose parents have been detained or deported that are falling into crisis. And so I just would say that it is a very difficult time indeed. And staying in this work and being able to bear the pain of that is something that I'm reflecting on, particularly because I'm not from lived experience, not only how I can be an ally, um, not only how I can be an ally, but how I can be on the front line because I have more protection, because I have more privilege, and how I can, and am obligated to in many ways because I have more margins, be a compassionate presence for people in distress. Um, and how do I hold that in a way so that it can be helpful to others? How do we keep raising this issue to elected officials? How do we keep raising this issue to the public? How do we not become numb to this and still show up for work every day? Those are things that I've been reflecting on lately. I'll stop there.
Thanks, Beth. Hopefully we can say a little bit more about each of those things. I appreciate you raising those. Diem, can I turn it to you?
Yes, thank you so much for having me here today. And my name is Diem Nguyen. Um, this presentation really, this panel discussion really represents my work in so many ways. My background is in education and health. I had spent over 15 years working in the field of education. First, as a community educator working with immigrant and refugees, and then as a researcher and instructor, again, focusing on immigrant and refugee families, looking at adaptation and educational contexts. And during this time, I also observed and documented tremendous levels of mental health concerns related to trauma, intergenerational trauma, domestic violence. And so these were just for me working in the community, working as a teacher, instructor, it just created a lot of concern. And at the same time, this is a couple of decades earlier, there were so few resources for immigrant and refugee communities, and we were not seeing immigrant and refugee communities able to talk about mental health, well-being in the context of Western mainstream contexts. And so I was very interested in going back to school and finding ways to help and support communities to address some of these concerns. And so I went back and got my MPH focusing on mental health with a focus on immigrant and refugee communities. And since 2018, have been working in this field, looking at the really in the intersection of immigrant and refugee health and education and well-being. I am currently at the University of Washington in the Global Health Department, as well as very much situated in the communities with a community-based organization, working with communities to talk about mental health, to understand their ways of thinking about mental health, and creating programs that are relevant and culturally based. So that is for me a space to be thinking about research and teaching in connection with policy and advocacy and community involvement. And it's taken me several decades to get to that position in the sense of the connections across all of those different spaces. And it is an intentional space to be able to speak and bridge across all of these contexts. I'm going to take a deep breath as I try to speak about this current moment that we are in. It is, to say the least, incredibly hard. And every day, really thinking about being in communities and doing this work, holding myself together because I am also myself a member of these communities. I have a refugee background. I came here as a child from Vietnam, escaping the Vietnam War. And it's taking many, many years for communities that have experienced war and violence to feel a sense of safety. Speaking about my community. Um, but now that we're seeing all of these different spaces of safety being eroded, being challenged, being pushed, communities that have taken so long to begin to heal, begin to talk about mental health, begin to talk about intergenerational violence, are learning that it is not safe again to congregate, to come to these spaces, to talk about these things. And so they are slowly hiding again, hiding these painful conversations in a way to protect themselves and to not feel so vulnerable. And then also teaching their children again to hide from these experiences, to not talk about these things. In a sense, they don't want to be targeted again. And so it is so many levels of assault on a daily basis. And it is also unraveling a lot of trauma and a lot of wounds that people just are in a space of not knowing how to really think about these things. And so, in conversations across communities that I am privileged to work with and be in, I'm hearing a lot of fears and concerns and whispers and anxieties. And that is just the state of being for many of these communities. We are seeing impacts on in so many ways. Immigration policies, I mean, so many on a daily basis. But I want to speak a little bit about, because I also work with a couple of organizations that are dedicated to health and well-being, and we have been doing so much to help communities think about vaccinations and getting vaccinated post-COVID. And so we're seeing the changes in vaccination policies and standards, and that is also having such a tremendous impact on the health of these communities because they are already communities that have vaccination hesitancy. And so now we're seeing that people are not getting vaccinated. Families are not taking their children in to get vaccinations. So it's just very concerning on so many levels. And then currently we are also seeing food insecurity due to the increased cost of living, especially in our region. And so right now, in working with two of our communities, we're scrambling, really scrambling, especially at this time, to figure out how to support communities with food insecurity right now. So these are just so many of the concerns on a daily basis. And so for me to be in this space personally and professionally, it is every day taking a deep breath and reminding myself of my own privileges, but also just really holding back my own emotions so that I can be present in the best ways that I can to support the communities that I can. Thank you.
Thanks, Diem. Kevin.
Good afternoon, everybody. My name is Kevin Roxas, and I'm so excited to be a part of this panel and learn from my colleagues here. I'm often, even at this point, I'm often surprised when I'm asked to speak on panels, like, what do I have to offer? So I enter the space in that regard, hopefully something. I must start with just a little different. There's a comically large photo that's on my desk. And I don't know if you can see it. I hope you can see closely. But if you see that it's a big family, obviously, and if you look closely, there's a woman in black near the globe, and to her left and right, there's an older man and an older woman. And I share that as a photo because it's right on my desk. And it's a photo of my mom when she was she was one of 17 children living in a village outside of Manila. She was the first of 17 children. She was the third oldest. This was the day she left the Philippines, the first one in her family to leave the Philippines, to look for employment. She had a visa and to step onto a plane and not know what was on the other side. She eventually met my dad, who became her husband, And they had four children. I was the third of those children, and we were raised in Chicago. At that point in time, she was able to get a visa that was for people who were nurses or doctors or engineers. That was a large part of availability of visas at the time. And so it was a very small community, and that's where she met my father, and then eventually met people who became my aunts and uncles um, by choice, because we didn't have any relatives in the Philippines. I share that story with you just as a start because I'm the son and child of immigrants. I saw firsthand what they did to have us, along with some of my colleagues here, to have us be as successful as we could be and to provide resources for us. And to see the racism and discrimination they felt along the way, but we live in a different time now. And I have that photo on my desk just as people walk in, to remind people of the work that I'm engaged in as a scholar and as a professor. I've been working in education for about 30 years now. I started as a teacher in the Bronx, New York, and then taught in Kobe, Japan at an international school. I was a teacher and then a principal, and then I taught in Michigan State, where I was getting my Ph.D., and then Laramie, Wyoming at the University of Wyoming, now Western Washington University the last 13 years. As introduced earlier, I'm the Dean of the School of Education here, and I'm so proud of the work we do because we try and root our work in the experiences of youth in communities versus just we're teacher education providers or people who prepare nurses. We do that in the service of people. So that's just by way of introduction myself. In addition, when I was doing my PhD and then fast forward, all of my work has been around the experiences of children who are coming from immigrant or refugee backgrounds and the context of the resettlement in the United States. And what I mean by that is, what do children themselves say? What do their parents or caregivers say? And what does that mean then when we actually interview their teachers too? And again, I'm speaking from a school-based experience because those things don't often, connect to one another, right? So in other words, parents and families want this thing, but teachers maybe want another thing. And so what happens in the middle of that? Things get lost. The needs of students, particularly in this political time, get kind of overlooked. And so this is an issue. Lately, I've been doing a lot of work with photo voice, the use of visual narrative and photography in helping families and children tell their stories, and documenting that, what's important to them, and then putting that art into public spaces, like, for example, coffee shops, having discussions around what does this mean to the community. I think in terms of, so that's a little bit about myself. In terms of the current moment, I think about a number of things, and I'll be short here because I know we're on time here, but thinking about, well, what does this mean then for children going to schools? What does this mean for children not going to schools? Meaning they don't want to go to school because their parents are worried about what will happen when they go to the pickup line or the drop-off line. Literally, ICE being outside of schools or near schools, right? Seeing it in communities, people being pulled from cars. That has a chilling effect, if you will, on the willingness of people to bring their children because they don't know what will happen next. What does this mean in terms of the ways in which children are treated by other children in schools? Because if the political rhetoric is you are different than us, then you will be treated as different from us, and you will be the subject of possible more racism and discrimination in that place. So what does that mean then? I think, and I'll just end here, but the other point would be around even in a already stressed budget situation in the state of Washington, what does this mean then when there's fewer students attending a school? Because school funding is based upon the amount of students attending a school. So if we have fewer students in attending this school, which is a higher amount of children from immigrant and refugee backgrounds, the per pupil funding, the amount of money going to that school decreases. So therefore, we have an even worse situation on our hands relative to that funding model. So I just want to, by way of introduction, those are some main points I wanted to share. Thank you.
Thanks, Kevin. I appreciate that. And all of you have already raised some of the very, very big challenges that these communities are facing. So we can talk a little bit more about that if you can highlight a little bit more about some of the biggest challenges that are being faced and also what resources that the immigrant and refugee displaced families and communities are already bringing, that they have themselves that they bring to the table, but also what resources are available to them. And Kevin, I'll ask you to get started with that.
Thank you. I thank you for allowing me to go first in this section. I almost was catching my breath, but that's all right. Thank you again. No, it's great. I think one of the biggest challenges. I think I started to talk about those earlier, just now, but I think this kind of it's almost a trap of sorts. I mean, I don't even know how to explain it. Maybe that's not the best, but it's you're heading into a situation. Imagine, you're this student from a newcomer background. You're arriving in the United States. A couple weeks later, a month later, you're arriving in a public schools, and you're trying to make sense of it, right? Trying to make sense of maybe a different schooling environment, the different way in which the teachers engage with you, perhaps a different language. This might be your second or third language that you're learning. And then also maybe having this feeling of stress of being dropped off, and maybe your parents being stressed or your caregivers being stressed. So that right there would impact the ways in which you can address learning or learn a new language or just feel comfortable at home. I think some of us, like, that's just a luxury. That's just how we are. That's the way we don't even think of it. But here, what if I'm always thinking about it all the time? What additional weight does that place on my shoulders? I think, the other part would be around what forms, and so that part of the cultural adjustment, if you will. Cultural adjustment is probably not the right word, but I'll leave that there. I think the other part is just, I mentioned it earlier, but what kind of bullying or racism might you feel? Feel or face? If this rhetoric is on the news by people in power, then all gloves are off, right? Quite honestly, that means that it's taken for some, and I know one of my colleagues said it shouldn't be taken as normal, but some people then take it as normal. So then what do we do with that? And then I want to say one more thing is then what do teachers do, right? And so I want to just, because I'm an educator in the College of Education sense, some of our teachers don't have those training or tools or know how to work in this realm. So sometimes, quite honestly, they might avoid it. Sometimes they might address it, but we probably have a split of ways in which it's addressed. So students get confused about, what is their place in the school. Unless the school is very specific, the principal is very specific about the ways in which they're messaging, how children are welcome from all backgrounds, or their parents are welcome, and there's programming around it. Students themselves might be facing some mixed signals that are problematic. And then, I just want to say, and I just want to take it to a future lens. What does this mean for people's future, right? A lot of my work has been with children from refugee backgrounds and immigrant backgrounds. But what I'm trying to say here is, well, if I'm not sure about middle school or high school, how am I going to finish? And what does that mean then for my future employment, right? This is generational, right? Because if I drop out of high school, because of all these factors that we've been talking about for the first 20 or 30 minutes, that changes the life course of my life, but also my children. And so I want us to work toward a different way of being, a different way of thinking about the challenges ahead, but also the ways in which schools can address them. Thank you.
Thanks, Kevin. Diem, you also raised a number of key critical challenges that the communities are facing, the community that you work with. Maybe say a little bit more about some of the biggest ones and what resources and strengths there are.
Yes, thank you. Yes, I was starting to talk about because I talk about a couple of those concerns. Currently, I am serving in a community health board, the Vietnamese Health Board, and also a coalition of 16 different health boards. And the work there is really focused on health and well-being. But for us, to talk about health and well-being, again, they intersect across so many different social factors. We're thinking about the social determinants of health, right? Social determinants of mental health. And so all of these different things that we're seeing, the policies and the impacts on those, from those policies impact health and well-being. And so to focus on mental health, for instance, such as the work of the Vietnamese Health Board, is to understand the stress levels and all of that is happening to the bodies and to the minds and to the daily experiences of what's happening in the communities, but then understanding the cost impacts, right? And so for us, It's two of the things that are having such big concerns right now for us are in our region, thinking about current policies around immigration and the cost of living and the concerns around health insurance changes. And so all of those have such impacts on the daily lives of people's health and well-being, the stress that keep accumulating over time and building on each other. And so it's just kind of hard to unravel and peel back some of these things. But we're seeing that the vaccination levels, for instance, are falling behind in our communities. And this was something that is really difficult for us because during COVID, the health boards in the community did so much work to encourage communities to build trust, to talk about the importance of vaccinations. And then now seeing the changes in the standards and the policies, communities are talking about it very differently, and that's concerning for us. We have people in the communities that are choosing not to vaccinate or get a booster for the measles, for instance. Flu vaccines are falling off and COVID boosters. So this is just the impact over time in the community. And the conversation along with that is also what is distressing for us as health boards, that people are saying that, vaccinations don't really matter, that COVID is over. We're going to get the flu anyways, even if we get a flu shot. And so it just, all of this erosion of trust in science, trust in medicine, trust in just what we have been taught for so long or encouraging communities to do. The other thing that I want to talk about is currently in our communities, food insecurity. And it is also a very hard topic to talk about because of the stigma with food insecurity. And so yesterday I was working with a group of folks in the Vietnamese community trying to figure out a way to share resources in the community, and a very small amount of resources, food vouchers, and trying to figure out, okay, we know because we did a survey recently of the concerns in the community, and food insecurity came up as a priority. But people were afraid to ask for help. And so these are things that people talked about in the survey. And so trying to figure out how to deal with the stigma and the concern at the same time, and how to do it in a way that doesn't bring shame or increase stigma. And so just again, the challenges of why are we in this current time experiencing such high level of food insecurity? Especially for communities that are already vulnerable. And so I am very concerned about this. And it will become an increasing concern. And so all of these things, I talked about this earlier, to add to the level of mental health and depression. We're working with a group of of youth and recent college graduates. And there's tremendous depression in this group because they don't know what their future is going to. Kevin, you talked a little bit about their future. They're afraid of not being able to secure a job, and their school loans are accumulating, and not being able to find work, and being a burden on their families, and it's just tremendous. Um, so many layers of concerns. I will stop there and.
Thanks, Diem. Beth, same question. I know maybe we've already been talking a lot about some of the bigger challenges. So, what are maybe one or two of the biggest challenges, but also some of the resources that you're seeing?
I will say, I'm going to start with the resources because I'll say that forcibly displaced communities bring huge amounts of resources with them. It takes such incredible future orientation to think about and take the leap to create life in a new country, and then to actually do that and create new social capital, new connection, you know, to be able to hold multiple identities and even reshape a new one for your context. And I think that also one of the things in working with forcibly displaced communities that I've seen is that the connection of the community is a huge resiliency factor, and especially during this time, because communities can be more nimble and more responsive and do things that mainstream organizations can't. Faith plays a huge role with many forcibly displaced communities, and family. So faith, community, and family are tremendous protective factors. And so I think people have all of those things that they have relied on for years to carry them through with tremendous strength and resilience. And right now, I also think there are tremendous forces that are threatening even those strengths. I have been focused a lot around child protection lately. We know that when people come to the US, they've often faced tremendous traumas. The stability and predictability, which is also a huge factor in recovery from trauma, if they can find it here, they can work towards recovery and healing, and healing for the future. But we also know that trauma can be cascading and compounding. And right now, in addition to past trauma, many communities and individuals are facing current trauma. And when people lose their status or their ability to get a job and they can't get their basic needs met, they often enter into an informal economy. Informal economies are often less protective. We know when families have a caregiver that gets detained, deported, the risks of child exploitation, abuse, and human trafficking go up tremendously. Many people have seen some of the reports that right now, when they're separating families, they're taking children who don't have current documentation, they're putting them in shelters, and where they've been for at least 6 months or longer right now into these institutional settings. For ones who do have documentation, many of those are entering the foster care system, which was never well funded or particularly healthy beforehand. But many of the older kids, I would say like 14 and up, they're just in the wind. They're just in the wind, couch surfing, doing these other things, which puts them at just such tremendous risk for abuse, exploitation, and human trafficking. These are the types of things that are really on my mind. And I think, you know, one of the things that I think about, what are the resources, knowing providers, knowing the resources that exist in their community, and not just the formal ones, but the informal ones, churches and mosques and temples and mutual assistance organizations and ethnic community-based organizations where people can go to not only find community, but also to find those informal supports, which, like I said, often are more nimble, more culturally responsive, are able to meet the needs of those community members. Every single person that's working with forcibly displaced people now need to understand the legal supports that are available in the community. They need to understand how to refer people to reputable low bono or pro bono lawyers, how to educate families about notorios and people who will take advantage of them. Because I can guarantee you right now, what we're seeing on a massive scale is these families and individuals are under threat, and people are using their fear to exploit them, targeting them for exploitation more and more. We have had so many of our clients who have lost $3,000, $4,000, $5,000 from people offering them avenues of permanency that just do not exist. And there was one other thing I was going to say, but the other thing is if you're working with families, think about how you're going to respond to these topics and also how you're going to approach these topics and what resources you have at hand. If you have somebody who is at risk of detainment and deportation that has children, do they have a family separation plan? Do the children know that plan? Do they know where they can go in case when they get home from school, a caregiver or a parent is not there? Do they know if they want their children to come with them? These are hard, tremendously hard conversations to have. But in every organization that has a high population of people at risk right now, they need to be thinking about these things. They need to be educating their staff about these things. They also need to look at structuring so there's somebody who may be a focal point to have these sensitive conversations, or a focal point to be gathering up-to-date and timely information, because it is really like drinking out of a fire hose these days. And I will say one more thing and then I'll stop, is even people may not know this, but right before the Monday, I think it was before Thanksgiving, they are now looking at all refugees who've resettled from the beginning of the Biden administration and all people who got asylum reopening their cases. Reopening their cases. One of the things I've seen a lot, around volunteering, if anybody can do fund drives for legal organizations right now, it would be one of the most helpful things that you can do, because we're looking at the thousands of clients that have just been resettled through IRC. All of them need attorneys right now. Every single one needs an attorney. That would have never happened at any other time. So there is so much to be done. Pick a place you're passionate about, and every, the old saying that, every drop of rain fills a river. Everything is needed at this moment.
Thanks, Beth. My thought about sharing some of those, that's excellent suggestions, and maybe the panelists would be willing to share those, and we can email them out. Any suggestions you have about places to donate or support in that way. And thank you, Beth. Anisa, I wanted to give you a chance to also address this question about challenges, but also resources.
Yeah, no, thank you. I think I'm seeing many of the same things that my colleagues are seeing, and really look towards the same resources, et cetera. So I won't repeat any of the wonderful points that they had, but absolutely the mental health effects, et cetera. I think one of the biggest challenges, especially for me, if I can kind of zone in on to my, the two hats I wear, one as a pediatrician, but then also as a parent and a person with lived experience myself, is the chilling effects that Dr. Roxas spoke about, and the confusion and the chaos created by this consistent attack. One of the things that we see that it leads to, that then has tremendous effects on their people's access to resources, it is no longer feeling comfortable going to places where resources can be sought. And that includes coming to your doctor, right? We lose access to a lot of our patients because, unfortunately, as much as I would love to, and I've implemented policies, et cetera, that safety is not guaranteed because we are no longer a sanctuary site. Not going to schools. And again, it's an access point to not only support and resources, but it's beneficial for the social emotional development of children. And then 3 is community gathering spaces. We know that community, although we somewhat live in an individualistic society, for many people who've migrated, community is very, very important. And when you rip that away from them, it really puts them in a place of vulnerability. So that's a huge challenge, because even if there are resources, there's no visibility for the resources that could be there. Through many clinics, I know that, we're looking at, we see a lot of food insecurity, not only connecting people to food banks, but, soliciting donations, giving people food vouchers, giving people money, and not really asking, what are you going to do with it? And I think that's one of the things that actually is well intended, but truly, I think we really need to think about when you're giving somebody a monetary money, anything, a gift card, please trust that they will do what is best for their family. And once that money leaves your hands, I think it is actually really harmful to ask so many questions about, are they going to use it for food? Are they going to use it for whatever? We need to really just give families what they need and trust that they will do what is best to take care of that family. Um, and then I think, I'll put this toolkit that was developed out of Minnesota, which I think I haven't found one similar to it in Washington State, but supportive schools for children, for immigrant children. And it goes down to the policies and procedures in place, like making these places safe places, because we know that if a child is in school, the school should, right, be a safe space for them. It's a good gathering space for them. Many schools have counselors, therapies, etc. But also there are resources and group supports that can go through that school. And I think, I actually do recommend talking to, schools in the area and seeing what they're doing and how we could help the schools, and also ensuring that, if you are in a position of power, it means a lot for the school to hear from you. Things change a lot if I call in as, hi, this is Anisa Ibrahim, can I talk to the principal? Versus if I call and say, this is Dr. Ibrahim calling from Harborview. There's a bullying concern in your school. Things change. They shouldn't, but they really do change. So that is a level of advocacy that we really do need to be pushing to get people resources. And then I think the messaging is really important. Families and people need to trust that we are going to stand by them. And I think we need to be clear about it. We need to be clear about, even if there's nothing that we can do in the sense of like, here's a tangible thing for our family, an institution, a school, a community-based organization coming out and saying, this is wrong, this is an injustice, and we will stand by you in solidarity, speaks a lot. And it's really, really important. And people often forget that people are like, the communities are looking at us to do that. And by waiting for, oh, has another organization made that, is our president for that, we are essentially allowing ourselves to be silent. And that is always a betrayal when there's injustice going on. And gosh, what was the last thing? Yeah, I think I'll stop there for now. My colleagues said wonderful things.
Thank you, Anisa.
Yeah.
Thank you for the different resources that you guys are putting in the chat and offering. And again, we'll collect those and we'll capture the chat and share that in the email that comes out after the panel. I'd love it if the panel members have something they want to offer. Any practices for the professionals and providers working with children, youth, and families to support their well-being, as well as their own? I think one of you mentioned early on that this is an incredibly stressful time for the folks working in this area as well. So, things that we can think about that support the providers and staff so that they have the strength and the ability to continue doing the great work that they're doing, and offer support to families as well. And Beth, I appreciated you mentioning faith, family, and community. These are resources that communities bring, and how can we support those? So any thoughts that you guys have in that area? I was going to start with Anisa on this one again. If you have stuff you want to offer, and we can like pass it around. You want to take a minute? Sure. Diem, do you want to jump in there?
It's great. Yes, let's give Dr. Ibrahim a short break there. Yes, I think without the support of my community, family, and colleagues across all of these different spaces, it would be really hard to continue to do this work. And so I guess for me, the question around thinking about one of the things that Lily, you had asked us to earlier reflect on is thinking about trauma-informed care and support. And I wanted to talk to that point a little bit and thinking about what that looks like. And foundational to me, foundational to trauma-informed care is about trust and relationship building and collaboration, and to provide support and safety, not only for the people doing this work, but also for the communities. And so in all of this, what has been tremendously helpful and keeping us engaged and doing this work is finding spaces that offer a sense of trust and safety and opportunities for relationship building in your own everyday workspace with communities, in faith-based organizations, in all of it across all of these different spaces. That would be important. And inviting people into conversations, inviting people into any of the process that support decision makings, right? And so just building this network and that and continuing to build that kind of trauma-informed care across all of these different spaces is important. And that has been healing for me as well in this work. And not just feeling like I'm the one providing the support for folks, but is really how do we support each other? How do we build these communities together? And that has been my approach. Um, and then thinking about in terms of the work that we do across all of these different spaces is to consider both long-term and short-term short and long-term support. And working with families who are in crisis is trying to provide immediate short-term support and resources to help with the crises. And so coming up with a list, the list keeps changing because the funding situation keeps changing. And so really being up to date on what these resources are able to provide. And so it's hard for me to provide instantly, here's a list of resources because they're also being challenged with funding and everything that we're seeing as well. And so being up to date yourself in terms of what these resources are, what they can do, what realistically that looks like. And then also thinking about the long term. And then for me, the long term right now is thinking about spaces of advocacy, connections across, really thinking about the importance of policy conversations. I know that is really challenging right now, but at a local level, within the city, within the state and county, there have just been amazing conversations. And so plugging yourself into one of those conversations, it doesn't, I think Beth mentioned earlier, it really doesn't matter where you start. The support is needed across the board. And so plugging yourself into any kind of conversation that can offer policy support, advocacy. It could be in education, it could be in health, it could be within your own schools, and all of those spaces. It's so important to support the conversation on policy change and advocacy. An example of this is a work that we did last year, working across the University of Washington and King County Public Health, behavioral health, and also 16 different communities, is to really rethink around this question of mental health and what communities are thinking about mental health. And so it was a big collaborative effort across all of these different spaces. And how do we think about policy change? And it was with that provided support for communities to voice their concerns and to share their ideas around mental health. And from that, it helped to garner some support funding for communities to create their own mental health programs that are culturally relevant, that is center on their own communities. And so there's still tremendous efforts out there that are really supporting communities. And so not all hopeless, and especially within our region. And so I think wherever you can plug yourself in and be a voice of support and advocacy, I think that would be tremendous.
Thanks, Diem. Yeah, I want to make sure we have time to turn to some of the questions. So one, I want to invite anyone who's still holding some questions in their mind to put them in the Q&A box. We are also watching the chat, but the questions in the Q&A box, we can see them more readily. Anisa, do you want to jump in now? Are you ready to, you just muted yourself. That's okay.
Sure, I'm happy to. I'll keep it very brief. I think when you were talking about well, I'm not sure if you used the words, but what we're experiencing right now is either directly experiencing or bearing witness to human suffering and moral injury. And I think when these things happen, it's really important to, for yourself and for your team, sometimes it is a go slow to go fast thing. And it's really important to check in on your team, really check in on your team and really think about who, at what point do you need to take a step back, not from the work, but for yourself. Even if it's a minute, I think we think about these things as like big things. It's not walking away from the work. It's taking a minute to go outside and take a walk midday. It's taking a minute to have that cup of tea. It's taking a minute to say to someone else, this was really hard, watching the level of, witnessing the level of human suffering and knowing that what I could do is probably a drop in the bucket. But that drop in the bucket is also really, really important. And it's okay to feel feelings. I think in the direct service industry, it's, I call it direct service, but like when you're in front of a client, a patient, a person, I think we are taught, tuck your emotions and do what needs to be done. But I think it's okay to feel. And sometimes when we feel, it actually helps connect us a little bit more to the patients and the families and the communities that we're partnering with, because they see that we are also feeling it, but then we're also bearing witness to it as well. And I think that's also really important. And then the last thing that I will say is that many of these communities are going through significant levels of trauma. So when we are interacting with them, everything needs to be an invitation and not an expectation. And that's really, really important. There's already a burden placed on their shoulders, and these inquiries, these questions, I want to support you, that needs to be an invitation and never an expectation.
Thanks, Anisa. Kevin, do you want to add anything?
Sure, thank you. I'd say maybe three things that I'm thinking about, and many more. I think the one thing that I want to go back on what I said, or not go back on what I said earlier, but I mentioned teachers who aren't sure what to do. I think then it's our role as teacher educators, in my instance, as in College of Education, to provide those resources, to work toward preparing teachers who are in practice now to know what to do, or to know different strategies for know what to do, but students who are becoming teachers to also be prepared to do that work. Anisa mentioned at the very end, like what are some, I use the word sensitivity, what is our understanding and ways to build connections with people in ways that are responsive to them and respectful of them too, as they are going through significant trauma forced upon them. I want to say a couple things. One is around this idea of ways in which schools can be created to be responsive to these needs. I work with a school, and there's different research on newcomer centers, but a school district in Denver that created a school where the school principal was given a building and asked to hire teachers who wanted to be responsive to the needs of children from refugee and immigrant backgrounds, and then was given kind of a blank slate, if you will, to start it from the ground up. And that was really a successful endeavor because she was able to find people who wanted to do just this work, do this work. I could talk more about it, but I just want to explain that that's a possibility. The second thing that I want to kind of shed light on, and I put it in the chat earlier, but one other thing for us to do is to advocate for these resources, but to also write about them or to do research upon them, which my colleagues here are doing. But I think that brings more focus to the needs, right? So we continue to speak to people who are in these situations, but also highlight what's happening so that it just doesn't go untold. So I put in the chat, I'm the editor of a journal called Multicultural Perspectives. And our most recent issue was on the title, The Voices and Experiences of Newcomers from Refugee Backgrounds and Those of Their Educators. So just as an example, and I put the link to that article, to that special issue. I already know this: knowledge, agency, and self-definition among refugee background youth. I rely on God. Religion is a fund of identity in the resettlement experiences of refugee background parents in the U.S. A place to call home. Stories of a young refugee background child navigating classroom, marginal, and neighborhood places. So I share that. Those were just 3 of the 8 articles, but are we writing about this? Are we shedding light on these topics so that people can see what's happening, and also the trauma, but also the ways in which we can be strengths-based and assets-based on the ways in which we engage with families in schools as a way to continue to move forward. And I don't know if this is the best time, because I know we live in a time where people, Anisa mentioned earlier, just, people are already taxed. But I'm going to end with this idea. One of the articles talks about, and I want to make sure I get the title right, the community walking interview, engaging pre-service teachers with refugee arrivals experiences. Earlier I mentioned maybe our pre-service teachers, people who are programming teachers, don't have experiences with children from refugee youth or immigrant youth. So what would it look like if instead of making guesses or just reading about it in an article, having real conversations with people as they're able to, as the community is able to, and also seeing the community or the school or places of worship from their perspective and taking it from an assets-based perspective. Can you help me understand what's going on in this neighborhood or what's in the community from your perspective? And again, this is probably a tough time to do that, but if we engage in that route, we don't work upon assumptions. We work upon, a conversation with the community as best we can. So I'm going to end there. Thank you.
Thanks, Kevin. I appreciate you bringing that up. I think there was a previous question in the Q&A that disappeared. I think maybe the person had to leave, but it was about, guidance for someone, a young person becoming a physician. And you've brought up pre-service training for teachers and really just thinking about the young folks or people who are entering these careers right now, whether it's teaching, medical, social work, nursing, and at this time where it is so fraught, and they're working with folks who are experiencing more stress than before, or across the board, but especially in immigrant and refugee communities. So really thinking in terms of the training that they're getting and how we can be incorporating well-being and resilience resources, even for those folks as they're just about to enter this career. Beth, you want to share some thoughts about trauma-informed practices or practices that support well-being?
Thanks so much. And Lily, I wanted to say it's still in the chat. It's just in the answered tab. I think we know from emergency settings that people need information and time. And so knowing what information that you have at hand that you can provide, including what you don't have and what you don't know, is always going to be helpful. And then people need time to process that information. And they need empathetic listening and validation as they're expressing themselves. And so typically what we see for clients is they need to be reached out to more often with information. And we also need more time for appointments so we can go through that information or listen. For staff, it's pretty much the same thing, making sure that staff are having at least 1 hour of supervision a week. And there's part of that time is to check in on them and see how they are. Having regular communication with staff, including, at least right now, most of the staff at IRC are from forcibly displaced backgrounds. Most of the staff are impacted by the same policies that the clients are impacted by. Knowing that even just things like we will be communicating, we'll provide a digest every Monday of all of the policy changes and our analysis of them. We will be providing town halls every other week. We have an FAQ document where you can ask questions and we'll try to find answers for you, recognizing that we may not know everything right now, because a lot of this stuff, how these things are going to roll out, is still very unknown. And so I think providing that safe, from a trauma-informed perspective for both clients and staff, information, time, and empathy are kind of key.
Yeah, thanks for saying that. And in fact, there's a question in the question answer. What does truly trauma-informed care look like outside of clinical settings like schools, community groups, volunteer programs? And I've heard a few thoughts on that already. The time, space, recognition of a range of responses, in really individual responses that they're carrying forward, and invitational approach. I think Anisa, you mentioned that everything is an invitation and not an expectation. And I wonder what other thoughts the panel has in response to that question. What does a trauma-informed approach look like in non-clinical settings, in schools, in community organizations, community groups, volunteer programs?
Jumped in with one that I'm just so proud of that we've been able to really study, is called Healing Classrooms, and it is an educator program about how to create trauma-informed classrooms. And it's a professional development for educators, and it actually started in schools that were in refugee camps. And now it's being used in many countries, including Germany, the UK, Italy, and in the US. And so people can Google and search for it, but the Healing Classroom is curriculum is online. We also have something called Safe and Healing Learning Spaces, which is for those after school programs. To create trauma-informed spaces as well for students. And both of those should be free and open source online.
Thanks. And we have a comment from E. McCrae asking us to switch to talk around healing-centered instead of trauma-focused. And I appreciate, Beth, that you highlighted some healing-centered approaches. Any other suggestions in this area, Anisa?
I mean, in addition to what Beth was saying, and I think that might be Alan McCrae, I completely hear you. People are more than their trauma. And knowing that there are certain things that happened that could continue to affect what people are feeling in these spaces. I think some approaches are, again, just the imagery that goes into walking into a place. Do I feel represented? Do I feel reflected is really important with regards to healing. And then one thing that I always caution organizations, but specifically schools, is the presence of law enforcement, because Black and Brown communities have not historically had a good relationship with law enforcement. In fact, they've actually been the cause of a lot of the trauma in these communities. So what might seem like, safety to some of your classroom or your student cohort might actually be actively re-traumatizing people, and doing something like calling security or things like that can actively re-traumatize a lot of people, and it does not lead to increased healing. And if somebody's already escalated, doing something like that immediately actually does not cause them to immediately de-escalate. But even outside of escalation, I think the very presence does trigger feelings that are not positive, regardless, just given that historical injustice that has been carried out in many communities. So that's one thing that I'm like, I understand that sometimes that there is need for it, but just that presence itself does change whether or not the space is going to be considered healing.
Thank you. I forgot to unmute. I just want to say we have one more question. We have time for one last question. What is the biggest misconceptions that well-intentioned allies should be aware of when trying to help? Does anyone want to jump in?
Well, I guess this is not a misconception, but it's a mentality, and I think it's that savior mentality that is actually really harmful to communities. And it's difficult to explain because it's difficult in different settings, but no community needs saving from an outside entity. It is more about partnership and collaboration, because often all of the resources might not be there for a good reason, and often things that are outside of that communities control, but the expertise in how to best do what is most culturally responsive, linguistically responsive, most healing to that community often lies within that community. So just the way in which you interact with communities, especially during times like this.
Really highlighting, thank you, Anisa, really highlighting that collaboration listening, learning, taking a, kind of really open-minded learning approach. There's that saying that we all know, nothing about me without me, and thinking about everything we do, being guided in that way. I'm afraid we're at time. I feel like there was so much to talk about, and I appreciate the expertise in the room. Thank you for those who stuck with us through this. We will capture the resources that were listed in the chat and send those in the email that comes out. A link to this recording will also be in that email. And we do ask, there's an evaluation survey in there, and we really request feedback so we know how to best meet what the interests and needs of the folks that we're reaching. So thank you to the panelists for all of your wisdom, expertise, and the time that you spent here. And we're getting lots of thank yous in the comments as well. And I really appreciate everyone taking the time to be part of this conversation.